system is going to be impacted by the ones who can bring innovation into it and sustain it. And this becomes one of the world's largest change management opportunities that we've ever seen in what we call a healthcare industry that is really just becoming an industry. When you think about the conceptuality of larger scale, standardization, and things of that nature. And that's one of the reasons, and this is the part about HIMSS, that it's been so wonderful to be a part now of a cause-based environment. HIMSS serves about 68,000 members globally. We have chapters around the world, and it really is a place where we convene and have an opportunity to push towards standardization, work with governments, work with providers. And it began really with an IT lens. It still has a tremendous IT lens. It's now expanded into provider and the use of information. And so our fundamental goal these days is the transformation of health through the use of information and technology, because the two go hand in hand. You know, it's the old adage of system cannot just have a technical solution. It's people, it's process, and it's technology. So let's talk a little bit about this crisis in healthcare, or at the very least, the challenges that every single system is facing today. And it's not a surprise that it always leads off with the age of our population, which is on top of us, the silver tsunami. This has a massive impact that is going to take about the next 20 to 30 years for us to work through and understand how we are going to deal with an aging population that is living much longer than any population before. And it has an impact not only on the services being provided, but on the economics as well. And because we're living longer, we will be developing, no matter what we do, some levels of disease burden in chronic care space. That is a function of living longer. But the intensity of it, we can talk about from a prevention